Analysis of silicosis in India, the crisis of silica scars. India's mining boom, while a catalyst for economic growth, has perilous repercussions for its workforce, particularly in relation to silicosis, a preventable but chronic respiratory disease caused by exposure to crystalline silica dust. As the country aims to meet soaring mineral demands, primarily for construction purposes, an urgent examination of the public health implications associated with silica mining is imperative. Facts and statistics. The Indian Council of Medical Research reported in 1999 that over 8 million people were at high risk of silicosis, a figure that has likely escalated with the increase in mining activities. The disease manifests years after exposure, often resulting in irreversible lung damage. According to the World Health Organization (WHO), silicosis contributes to a significant percentage of lung-related diseases globally, with an estimated 2 million occupational deaths annually due to similar conditions. Current legal framework. The Occupational Safety, Health and Working Conditions Code 2020 was introduced to establish legal protections for mine workers, requiring operators to report health hazards and provide free annual health checkups. However, compliance is grossly insufficient, with minimal enforcement from the Directorate General of Mines Safety. Moreover, the reporting of silicosis cases is often inaccurate, with misdiagnoses being common, which obfuscates the true extent of the problem. Pros of addressing the silicosis issue. 1. Economic rehabilitation. Addressing the silicosis problem can lead to significant economic benefits. Healthy workers are more productive, and reducing healthcare costs associated with chronic ailments leads to more resources for the economy. 2. Enhanced worker safety. Improving conditions in mines would not only protect workers from silicosis but also from other occupational hazards, thus creating a safer work environment. 3. Improved legal and regulatory framework. The enforcement of existing health and safety codes can ensure accountability among employers, leading to systematic changes and better health outcomes for workers. 4. Healthcare access. Establishing healthcare facilities in mining areas, as directed by the NGT, can facilitate early diagnosis and treatment, which is crucial for managing silicosis. Cons of ignoring the silicosis crisis. 1. Public health hazard. Continued negligence may exacerbate public health crises in mining communities, not only affecting miners but also their families and communities through second-hand exposure. 2. Socioeconomic inequality. Most of the mining workforce is drawn from economically backward regions. Ignoring their health can entrench poverty cycles and exacerbate existing inequalities. 3. Decreased workforce. Chronic diseases like silicosis can lead to decreased working age populations, further straining economic growth and exacerbating labor shortages in key sectors. 4. Resistance to regulation. The pushback from mining companies against regulations can impede progress, creating a conflict between economic interests and worker welfare. Conclusion. A call for action. Addressing silicosis in India's mining sectors requires urgent and multifaceted action. While the legal framework exists to protect workers, its implementation remains woefully inadequate. There is a pressing need for more rigorous enforcement of existing laws, improved diagnostic capabilities, and health services in mining regions. Further, the government must prioritize transparency and accountability amongst mining operators, while fostering an ecosystem that encourages safe work practices. The tragic irony is that while India strives for advancements in economic growth, the health of its most vulnerable workers remains perilously at stake. Immediate intervention is essential, not only for the health of millions but for the nation's moral standing in the global landscape of labor rights and environmental justice.